Known risk factors. Let's take a look at some of the factors that increase the likelihood of SIDS. Now, these are not causes of SIDS, but are associated with a higher risk. Understanding these can help us take preventative action. Text on screen. Sleeping on the stomach or side. Sleeping on soft surfaces or with loose bedding. Overheating, smoking during pregnancy or exposure to second-hand smoke. Premature birth or low birth weight. Young maternal age, inadequate prenatal care. One of the biggest risk factors is a baby sleeping on their stomach or side. Babies should always sleep on their backs until they are old enough to roll over on their own, which typically happens around 6 months. Sleeping on the back is the safest position because it helps keep the baby's airway open. Sleeping on soft surfaces or with loose bedding like pillows, blankets, or stuffed animals is another major risk factor. Babies should sleep on a firm mattress with just a fitted sheet, nothing else. Soft bedding can obstruct their breathing, which is dangerous for young infants who aren't yet able to push things away from their face. Overheating is also a concern. It's important to keep the room temperature comfortable, between 16 and 20 degrees Celsius, 60 to 68 degrees Fahrenheit. Overbundling the baby or keeping the room too warm can increase the risk of SIDS. Smoking during pregnancy, as well as exposing your baby to second-hand smoke, also raises the risk. Nicotine affects babies' developing lungs and can impact their ability to wake up when their breathing is obstructed. If you smoke, quitting is one of the best things you can do for your baby's health, and it's crucial to keep their environment smoke-free. Premature birth or low birth weight is another factor, as these babies often have underdeveloped lungs and other systems that put them at greater risk. That doesn't mean these babies are destined to experience SIDS, but parents of premature or low birth weight infants need to be extra vigilant about sleep safety. Young maternal age and inadequate prenatal care are also associated with an increased risk of SIDS. Though the reasons for this aren't fully understood, it may be due to a combination of biological and environmental factors, preventative measures for a safer sleep environment. So now that we've identified the risk factors, let's focus on the solutions.